1440 KVON 99.3 The Vine. This is Kelly. It is time for Healthy Communities with St Helena Hospital. And my guest this morning, the Operations Director of Service Line Management at St Helena Hospital in Napa Valley is Sam Ocampo. Good morning. I wanted to say Sam Ocampo.
That's better.
Because
That's better.
You know me.
Absolutely, Kelly.
You know how I am now. And also with us, we have one of the busiest cardiovascular surgeons in Northern California, and he's new to St Helena Hospital, Dr. Keith Korver.
Good morning.
It's great to have you here.
Thank you.
And welcome, because even though you've been practicing in the Bay Area for about 20 years, you're new to St Helena Hospital.
That's right. I've been practicing in Northern California since I finished my residency about 25 years ago. Mm-hmm. And just recently started practicing at St. Helena Hospital in Napa Valley. Before that, and still a practice in Santa Rosa as well.
So tell us a little bit about your background.
Well, I grew up in Northern California in a real small town. Some people may know where it is, but most people don't, called Susanville. My dad's a doctor, and I've always been around medicine most of my life. And when I went to medical school, I thought that I was going to be a family doctor, and I did all my training in that direction, and then ultimately I decided I liked surgery. And so I went to surgery residency, started out in Honolulu for 3 years, and then decided to pursue it more, ended up in Washington, D.C. and Georgetown. I really liked heart surgery at that point, and all my plans for primary care medicine and being a family doctor went out the window. And I went into something probably about as opposite that as possible. I ended up ended up doing heart surgery. And the reason I did it is because I absolutely love doing it. And
wow.
It changed all my plans. The first time I saw it, and even still, I just absolutely love doing it. So I'm kind of lucky in that I'm one of the people who gets to do what he likes every day.
Yeah. Me too.
Yeah.
That is really nice, though. And that's something that we were talking before we went on the air about heart surgery in particular. Kind of explain that to us, because I didn't know there was any difference really between putting in a stent or doing a bypass. That is all surgery to me.
Well, for patients, it's probably a little bit confusing who's a surgeon and who's not a surgeon and what a cardiologist is. And I still go to family events and get introduced as the cardiologist, and I tell them, no, I'm a cardiac surgeon, and people...
but that's the same thing, right?
Yeah, people think it's the same thing, but it is confusing. The way it is in the medical world is when you go into training after residency, you basically have the two worlds to go into. One is what's called the medical world, and those are specialties where you don't do operations. And usually those are internal medicine, family doctors, and that sort of line of medicine. And
primarily diagnostic?
Right, primarily diagnostic, not many procedures.
Oh, I see.
And then the other sort of arm of medicine are doctors who do procedures and are generally known as surgeons. So you go into surgery training, end up as a general surgeon or a urologist or a neurosurgeon or a gynecologist and do obstetrical surgery, different types of operations, orthopedic surgery, so the surgical specialties. Of course, the body doesn't know if you're a surgeon or not need a surgeon. So when people have heart trouble, they usually start out by seeing their family doctor and complaining of chest pain or something that leads them to see a medical doctor. And when I say medical doctor, I mean not a surgeon. So they end up seeing a family doctor. Someone may order a treadmill study, or they get an EKG or maybe an echocardiogram. And ultimately, the diagnosis and the problem may end up being at the heart. And the way I like to think about it is that the medical doctors work on, meet the patient and they end up at the heart. And I'm a surgeon and I end up on the heart too. So we sort of meet at the heart of the patient. If there's something that needs to be done with a stent, the cardiologists usually do that. And a cardiologist training is medical. By training, a cardiologist goes to medical school, becomes an internist, finishes 3 or 4 years of internal medicine training, and then does extra 3 or 4 years of cardiology training, and then maybe even a couple years after that to learn how to put stents in. And so that's how you get a stent, is from someone with a medical background. If it turns out that a stent can't be done, and the person needs an open operation. And when I say open operation, it means where you make an incision in somebody, usually with a scalpel, an incision, which can be up, usually for heart surgeries, up and down in your chest in the middle. Those operations are all done by surgeons, and in order to become a surgeon, you have to go through surgical training. Surgical training usually takes about 5 years after medical school to just learn how to be a general surgeon, and then it takes 2 to 3, 4 years longer than that to learn how to do heart surgery. So there's a lot of training that goes on in parallel, but it's not the same training.
And you've gone through all of this training and all this work, and yet your patient population is shrinking. Talk about that.
Right. Well, what has happened is something in the past 10 or 15 years that's great for patients and is good. And as I get older, I'm glad for it, actually, is that the treatment for coronary artery disease, which means the blockages, the arteries in the heart, has improved dramatically. The primary way it's improved is that there are fewer people that have heart attacks. And even with the aging population and all the baby boomers that are now old enough to think about having a heart attack, there's much fewer heart attacks. And in fact, there are fewer stents being put in now than there used to be. And all of medicine is getting to see the benefits of primarily statin therapy. And the statins are Lipitor, Zocor, the medications that we all know and see advertised, and many of us take. Crestor, These medications help lower your cholesterol, and they've absolutely changed how often people need bypass surgery. The number of people in the state of California that get bypass surgery is half what it used to be 10 years ago.
Half?
Yeah, it's one half.
That's amazing.
So
why does that keep you so busy?
Well, what keeps a person busy is that you need to, in order to be good at surgery, it's recommended that you operate frequently. And my analogy is, if you're a baseball player, you don't want to come up to bat once every week. You want to come up to bat 3 times a game and be active and stay good at it. And surgery is much the same thing. You don't have to do it maybe as frequently as playing baseball, but the recommendations are that you do at least 100 cases a year, 50 to 100 cases a year as a heart surgeon. And if you think about it, that's once or twice a week as a recommended minimum. So in order to stay busy, you have to be in a situation where you're able to stay busy and where there's a population that can sustain it. Obviously, heart surgery is not something done in every hospital or in every little nook and cranny, and you need special staff, you need an ICU, you need a tremendous amount of support. I'm always struck when I'm in the operating room and I look around. There's a patient on the table, and there's always 10 or 12 other people in the room all the time. It takes that much support, just in terms of people power, to sustain an operation, and that's just in the operating room.
And talking about the baseball analogy, we are at St Helena Hospital, Napa Valley, are very, very happy to have Dr. Korver as part of our cardiovascular surgical team because of his wonderful outcomes and his high volumes. You know, to have one of the best cardiovascular surgeons in Northern California at St. Helena is a wonderful, wonderful thing. I wanted to also talk a little bit about, from a layman's perspective, I'm not a physician, about the vessels of the heart. We have the large vessels and we have the smaller vessels, like the coronary arteries are smaller vessels that are on the surface of the heart. And those are usually what go badly with cholesterol, with smoking, with some of those risk factors that we talk about. And there are the larger vessels, like the mitral vessel or the aortic vessel. Those vessels have valves. They have openings that open and close as the heart pumps. And the patient population for valvular defects has not shrunk. That patient population is steady. And we want to but we want to also focus on valvular procedures, valvular centers of excellence at St. Helena Hospital, Napa Valley. And who better than Dr. Korver to, make those procedures available for the patient population of Northern California.
So if someone wants to, if someone is listening right now and wants to meet with you or to get more information, I mean, do they need to be referred by their doctor, their family physician to you, or can they go directly to
People,
you?
it's interesting you bring that up. People can see a doctor now many, many different ways. There's a lot of direct patient to doctor information available. The internet has made it very democratized. You don't have to necessarily go for your family doctor
Chain of
and then a
command.
chain of command. It's
Yeah.
completely changed,
Right.
and we all know that from everything that we do in life.
And Dr. Korver will have an office in St. Helena at St. Helena Hospital, Napa Valley as well. So
Okay.
that will be, accessible
An
to
opportunity
your
to-
to your listening audience.
Right. Okay.
So to answer your question, they can come through any way that they want, from direct contact to the hospital,
Great.
through their cardiologist, through their family doctors.
Fantastic. Well, we want to be sure and give out the information of how people can contact St. Helena Hospital. There's a website, sthelenahospitals.org, and you can get all kinds of information there about Dr. Korver and other doctors and other services that you offer at St. Helena
Absolutely.
Hospital, Napa Valley. There's also a phone number you can call, 707-963-3611.
And I wanted to speak a little bit about the tradition. Dr. Korver and I were talking about it before we went on the air. The tradition of heart care at St. Helena Hospital, Napa Valley. It has been the first heart care institution with open heart surgery and interventional cardiology north of San Francisco.
Wow.
So it has a tradition, it has a huge volume, and we are on, did we say, phase 2 of building that tradition with the advent of Dr. Korver and some of his colleagues. So we are very, very excited about it.
That is very exciting. It's nice to have right in our community. Well, I want to thank you both so much, Sam Ocampo and Dr. Keith Korver. Thank you for being here this morning.
Thank you, Kelly.
And that is
Thank you.
your Healthy Communities with St. Helena Hospital.